We often come across kids whose parents keep receiving complaints from school, telling they are not focusing in the class, they're disturbing other kids, they're not sitting in one place. Even relatives complain to the parents saying that they're disturbing their kids. Or when they visit someone's home, they are like pulling out the things, breaking things and whatnot. They're always labeled as troublemakers in the family. But could they be suffering from any undiagnosed medical condition? The answer is surprisingly yes, that's possible. Attention Deficit Hyperactivity Disorder, ADHD. ADHD is a condition that happens due to certain error in brain development. These kids may have a range of difficulties. First one is inattention. Because of this, a child is not able to give a sustained attention in any task. For example, it could be attending a lecture, completing the homework, studying, play activities and whatnot. They often may seem distracted when someone is speaking to them. And hence, the parents always feel like, the child is not listening to them, not following instructions properly. These kids may also tend to avoid all the activities which require a lot of attention. Also, they may find many activities quite boring and they may not engage in those activities. They may even make careless mistakes, letting go of some very intricate details. They may often make careless mistakes. They often tend to lose things also more often than other kids. Second symptom is hyperactivity. Here, the child is not able to sit in one place, always keeps fidgeting, tapping on toes, moving around, disturbing other kids, pulling other kids' hair, or just walking around in the class, jumping on the desk, etc. Third symptom is impulsivity. Here, the child cannot wait for his or her turn. For example, cannot stand in a queue and wait for the turn. Also cannot wait for the question to be complete before answering to that question. They may also tend to blurt out answers, interrupt others' conversation, go and interfere, speak out of the turn and whatnot. Before jumping into diagnosis that a kid has ADHD, it's very important to match the symptoms with the development level of the child. Also, if it happens in only one setting, there could be multiple other reasons, like for example, unstructured environment, parents not monitoring their kids or not being very strict with discipline of the kid. That may lead to some of these symptoms happening exclusively in home environment. Or something otherwise, like for example, at home the child is okay, in school the child is having these symptoms. Even then we need to think twice before labeling the condition ADHD to the kid. Now, I kept saying kid, but is ADHD exclusively a condition which happens only in childhood? No. ADHD can continue into adolescence as well as adulthood. Yes, but the symptoms may be little varying from children. The problem of attention often continues in adolescence and adulthood. However, the hyperactivity takes the form of restlessness. Just some sort of subjective restlessness, not being able to relax or not being able to calm down, always wanting to try new things, not being satisfied with sameness. They want newness in everything. They may even tend to have a lot of risky behaviors like say rash driving, risky sexual behaviors, getting into these addictions quite early. It could be say drinking, smoking, all other drugs, illegal drugs, and even behavioral addictions like internet and gaming addiction. Because they don't get high with routine things, they want something special or something more risky to get that high. So it's very important, as we see the consequences could be quite bad. For example, academic difficulties and certain other things in childhood, and as I told you, what all can happen in adolescence and adulthood. Now that we diagnose someone with ADHD, what are the treatment options available? First one is medicines. Medicines help in rebalancing the neurotransmitter imbalances that happen in the brain of these individuals. We often see that with medicines, there is improvement in all the domains of ADHD. There are multiple options available, and the clinician would prescribe something which will suit the patient profile and then monitor accordingly. Other than medicines, it's very important for us to do some non-pharmacological interventions. One of them is parent management training, where parents are taught how to handle these children, because these children definitely need a little more supervision, little more structured environment, and there may be certain environmental modifications required, including individual attention in teaching probably, and also certain modifications, like they may need more frequent breaks because their attention span is not too long. They can't sustain for hours together. So they have to split the task into smaller things and do it with frequent breaks, etc. Also, they may have a lot of behavioral issues, and that need to be handled with behavioral management techniques. Also, it may be extremely important to tell the teachers, to tell the school management about the needs of these kids so that the proper arrangements can be made. It is very important to diagnose these individuals at the right age and start treatment, because if left untreated, it can lead to so many other issues, including academic difficulties, other behavioral problems. In adults, as I mentioned, substance use disorders. It can also lead to depression, anxiety, so many other secondary psychiatric conditions. Comorbidities are more of a rule than exception in individuals with ADHD. That's why it's extremely important to diagnose and treat them and monitor them progressively, and also look out for all the comorbid conditions, which only a qualified clinician can do. So this video, you have understood the symptoms of ADHD and what all it can lead to, and also the different treatment options available for ADHD. If you like this video, please subscribe to my channel so that you can get more of such content, and also spread across this video, because you may be helping a child who is not yet diagnosed with ADHD but is suffering from the same. Thank you. Have a great day.